Welcome to the Optimal Longevity Series. My name is Dr. Court, and I'm here with Jonette Biebensheimer, the Corbier brothers, the duo team, and the infamous Dr. Prasad. But first, we're going to get some housekeeping out of the way. We're going to start with our disclaimer. These statements and comments have not been evaluated by the Food and Drug Administration. This information is for educational purposes only and includes recent advances in research on micronutrients. Engage, the micronutrient company, does not claim that our products diagnose, treat, cure, heal, or prevent any disease or injury. Engage's products do, however, address our deficiencies and provide our bodies with the nutrition we are lacking. Nothing here is intended to be a substitute for the treatment or a visit to your primary healthcare provider. With that out of the way,
let's get started.
All
right, everyone, welcome to the Optimal Longevity Series. And this topic has been a long time coming. And so tonight's topic is going to be on long haul COVID. And one of the things that I wanted to do before we introduce Dr. Prasad and our guests is one of the things in preparing for this call and in our travels, when we both lectured at CU Boulder in October of 2023 for a brain summit, which was really on the new ways of diagnosing mild traumatic brain injury with infections and toxins as well as trauma, which is going to dovetail into tonight's conversation. And I think that that's really important because it's really a brand new way of looking at symptomologies that are presenting from COVID-19 now and maybe what they were 2 years ago. But as we've traveled, some really interesting things have uncovered. And so I think that that's going to be a good segue in. But we'd like to, first of all, our very special guest, Dr. Kedar Prasad. And do you mind if I do it?
Go ahead.
Okay. So Dr. Prasad is the world's first radiation biologist. And he actually did his postdoc at the prestigious Brookhaven Institute. And he was the director and chairman of vitamins and cancer research at the Colorado Medical School in Denver for over 30 years. He has published many, many works in very prestigious journals such as Nature and Science, and many textbooks, and a brand new textbook to come, which is going to be on diabetes. And we want to thank you for coming on tonight, Dr. Kedar Prasad.
Thank you, Jonette. Always pleasure to be with you and Dr. Corbier and Dr. Court.
Thank you, Dr. Prasad. And we also would like to welcome our distinguished guest tonight, who we had the pleasure of meeting this past month at their clinic. They're just out of the greater Charlotte area. Dr. Jean-Renel Corbier, pediatric neurologist, and his twin brother, Paul Corbier, internist, and their beautiful team. Because boy, do they have a great team supporting them in the work they do. I want to thank them both. Just such needed work in not only autism, pandas, neurological diseases that are so complex, but now this post-COVID long haul symptoms that we're seeing. And so we're going to go ahead and turn the questions over for you tonight. And I know that Dr. Prasad has the questions. He also gave you his paper that he published in the beginning of COVID in 2021. But why don't I turn that over to you guys, and let's just go ahead and get started.
Okay, well, thank you, Jonette, and the team, Dr. Court, Dr. Prasad, and all of our listeners. It is a pleasure to be here. I think we all want to learn, grow, and share our experiences, and certainly see the role that micronutrients have in this endeavor. And we read the excellent article that Dr. Prasad wrote, and so we're certainly going to be focusing on that and asking questions around that publication there. Just a word on what we've seen and how we've thought about long COVID and why it's so important to seriously address it while supporting the body is that, in fact, long COVID, just by way of definition that we've all known by now, is that it is, interestingly enough, a brand new disease, that we've all witnessed, a brand new phenomenon where one has COVID infection, maybe acute illness, doesn't even have have to be a very severe case of COVID-19 infection, but it's the follow-up illnesses and symptoms that linger. And if it continues beyond several weeks to certainly several months with no other disease process, disorders, or diagnosis, then I think that earns the title of long COVID. And in fact, there are different terms. There's long COVID, long haul COVID, post-acute, all kinds of names, so, but we all know what we mean. And so we think it's still a bit of a mysterious condition. It presents in so many different ways, and we'll share with you what we've seen in the clinic. And we'll have questions on the micronutrients. There are even parallel terms like long vax and what at least some people might experience chronically after some of the boosters and so forth. But our focus is indeed on long COVID. And so I'll turn it over to my brother. He'll share with you a few statistics and then what we're seeing in the clinic. And then we'll ask Dr. Prasad the questions. So one concern is that, as we know, we were all hit with this pandemic of COVID-19, but it turns out that a subset of individuals will go on to have chronic symptoms. And the statistics vary. A lot of sources may cite about 7% may go on to have chronic symptoms, but some research suggests higher numbers, 10, 20, 30%. And this applies to adults as well as kids. What's most troubling is that up to 50% of individuals with long COVID or post-COVID syndrome may have debilitating symptoms that impair their quality of life. So we're dealing with a problem that's pretty significant and troubling for a lot of people. So then the question that we should ask ourselves is there a safe way to deal with this long COVID? Do people have to go on for many months with brain fog and pain and other symptoms, or is there a safe way? We'll explore that. Just a word on our clinic there. We've seen at least 40 patients that came to us with significant symptoms that we thought might be associated with COVID, and in fact, long COVID. So we'll talk about some of that and where the micronutrients may help. Let me have my brother talk about one of those patients, maybe our very first patient that we saw that came to us with what we think was long COVID or long haul.
So we saw a 36-year-old patient back in August of 2020 who presented with a really scary and long list of intense symptoms, ranging from various pain syndromes to chest pain, to sensory changes, loss of smell and taste, lots of neurological problems, recurrent TIAs, seizures, hallucinations, brain fog. By brain fog, I mean memory issues, concentration issues. And as you can imagine, she went to see a lot of providers, went to the hospital a lot of times. And we later came to understand that we were dealing with long COVID symptoms, but this highlights the multi-system, multi-organ type of nature and comprehensive nature of this perplexing problem.
We had a 50-year-old gentleman who came in. His presentation was a lot of gut issues, lots of gut issues. He saw the GI specialist. So we might ask ourselves, does the gut play a role in this? Can we do something about that? Had sleep issues as well, profound fatigue. In fact, that's a very common presentation of long haulers is chronic fatigue. We had a younger patient who had heart trouble. He ended up having a pacemaker. And so it really can affect a lot of organ systems, and I'm sure inflammation plays a role, et cetera. So go ahead.
Yes. So before we ask our questions, let me say that we're very impressed with Dr. Prasad's article. Supplementation with a mixture of micronutrients may improve ability of the immune system to fight COVID-19 infection. I think there are a lot of good answers, and we're going to ask Dr. Prasad some key questions that may help us probe into what can be done safely to help this patient population.
Sure. I get the first question.
All right. So, Jed and Dr. Court, can I jump in with the first question?
Absolutely.
All right. So, Dr. Prasad,